Oh, hey people! Thanks for joining us today. Today, our guest is going to be Erica Bumpurs, who is the director of the Student Health Center here at SAM. As a reminder, you have a chance to win a prize by participating in the live by either asking a question or interacting in some way. So, if check your DMs afterwards, and you might have a message from us that you've won a prize. So today's focus is primarily going to be on some campus protocols and policies regarding COVID, and then we encourage you to tune in tomorrow at noon when we'll be talking to Dr. Williams, who is the medical director of the Student Health Center, who will answer questions more specific to COVID itself. So we'll just wait a second for Erica to join us, and then we'll get started on some questions. We'll just wait. Erica, whenever you're ready to join us. For those of you that just joined us, you'll have a chance to earn a prize if you ask questions or interact in any way. We're just waiting for our guests to join us. Sorry, we're having technical difficulties. There we go. Hey, Erica.
Hi,
Thanks for joining us. How are you doing today?
I'm good.
Good. So like I was telling everybody, we're going to be answering some questions about COVID on campus and some campus protocols and policies, all the fun stuff. So why don't we just start? Can you tell people what some of the most common symptoms of COVID-19 are?
Sure. Now, before I start, I'm supposed to say, oh, hey, people, right?
Of course.
So, when we're talking about COVID symptoms, really, what's interesting about it is the list of symptoms are almost like any other illness you might be experiencing right now. So, cough, fever, runny nose, headache, body aches, which sounds a lot like flu or any other type of viral condition that you might have. So the symptoms are very common illness symptoms. So experiencing any of those is an indication that you might have COVID-like illness. So one of the things that I've experienced here at the Student Health Center is that some people feel like if they don't have fever, then it's not necessarily COVID related, but just for them to know that it's any of those symptoms and stand alone, they could indicate a COVID-like illness.
Good to know. So a lot of terms that we hear thrown out with COVID now are isolation. What's the difference between them, and when should students do each one?
Absolutely. So quarantine and isolation are different in that one of them is for somebody that is sick and one of them is for just somebody that's been exposed. So I'll start with isolation. If you have either tested positive for COVID or you've been evaluated by a physician and they have indicated that you have COVID-like illness, then you're going to go into isolation. So that means that you have symptoms, you are sick, and or you have tested positive. And so isolation is for the sick people. And then quarantine is if you have just had a known exposure. So you're not having any symptoms, you're not feeling bad at all, but you know that you were around your roommate or someone else that says, hey, I tested positive for COVID, then what quarantine does, it still separates you from other people. So you go into a situation where you quarantine by yourself. And what you're doing for that time is you are monitoring yourself for symptoms. And so it could be that somebody that's in quarantine, if they became symptomatic, they would then move into isolation. So some people may actually experience both situations, depending on their individual circumstances.
Good. So you mentioned all of those symptoms and that they're like a lot of other diseases. So how should a student know when they should maybe call the health center?
We want students to call us as soon as they have any concern. Either they have any of those symptoms, or even if they just have been exposed. They don't have to be sick to call us. And so we do a lot of visits where the students are calling us and just wanting to know, I've had this exposure, am I at risk? What do I need to do? So we definitely want to serve in that role, as well as evaluating students that are having any symptoms. One of the common things that we've seen is not just in students, but just in the general public, kind of saying, oh, it just feels like allergies, or, I just think I have a cold. And so they're waiting for several days before they reach out for medical direction or advice. So that's another important message that we want to send is don't wait. Because if you've been having symptoms for several days, you are already contagious at that point if you have COVID. So you could be unintentionally spreading that around and not getting medical attention as soon as possible. So we want them to call. We are doing telemedicine at the Student Health Center. So they'll call us and we will set up that appointment. And we're fine with that appointment being, even just, I'm concerned, what should I do? So they don't have to be sick to reach out to us.
Awesome. So we just had a question pop up and it ties to my next question. Can you talk a little bit about getting tested at SAM, how much it might cost, and how long the results are taking?
Okay, sure. So we have been doing testing here at the Student Health Center actually since last March. So when COVID first started to ramp up, we immediately got the ability to test through our lab. And so I'll talk about how we're testing now and then some additional technology that we're hoping to have in the near future. So currently, the way we test at the Student Health Center, it would again start with a medical or a telemedicine visit. And so to have that evaluation to determine if you even need to get tested, because it's not an assumption in every single case that you need to get tested. So that's our first conversation is we want to find out what's going on with you. Do you need to get tested? If they do need to get tested, then we schedule a time for them to actually come into the Student Health Center for the testing. Right now we're doing a type of testing that is called PCR. So it is a nasal swab. So the swab goes up the nose. We actually do both sides. And then we send that test out to a lab, and then the results have to come back to us. So there's a lot of variability in how soon we get the test results, depending on, honestly, just what's happening even across the state of Texas, if labs are getting backed up because of a lot of testing or a lot of illness. Right now, and pretty consistently for the past couple of weeks, we've been at a 48-hour window to get those results back, sometimes faster. And we even here at the Student Health Center, even though we're only open Monday through Friday, the 8 to 5 or 8 to 6 hours, we're monitoring for those test results after hours and even on the weekends. So we do have the ability to get results on the weekends and reach out to the students. I have a provider that is working weekends just for that purpose to communicate and follow up with students. The charge today is $70 for that test at the Student Health Center. That is actually what it cost us, the Student Health Center, to process the test. So that's what the lab charges us. Okay. So we're not upcharging. We're not trying to make profit off of that. We are charging students exactly what it cost us. And that charge, we don't accept payment at the Student Health Center. So that charge, just like any other charge at the Student Health Center, goes to their student account, and they would take care of that through the bursar's office. So one of the messages I've been trying to get out there is, if you're sick, we need to take care of you. If you need the test, we need to test you. And whether or not you feel like you have $70 today, it is nothing to be concerned about, because that can be taken care of at a later date. In comparison, just because we've got this question a lot, going other places in the community to get tested, There is free testing that happens usually once a week at the fairgrounds.
Yes.
Which is free. Granted, I get that. Free is cheaper than $70. However, there is no medical evaluation or follow-up or interaction that goes along with that. You simply drive up, they swab your nose, they'll send you the results. So I think there's a lot of value in that medical provider connection and us being able to help students understand what they need to do. And then the other technology that we're looking towards is the ability to do a rapid test actually here in the Student Health Center, which will decrease our time of getting results. We would have results same day for sure. The tests take about 30 minutes to run, but depending on our volume, we might not have results in exactly 30 minutes. Fortunately, with that technology, the cost actually goes down. We think we'll be able to get our costs down to about $50. And then I do know there were some town hall meetings last week with our new president, President White, and there is active conversation about supporting that cost and how to supplement it. So there's still a lot of moving parts around that, but to be completely transparent, today, if you call the Student Health Center and you need to come in and get tested, today it's going to cost $70.
Gotcha. So you mentioned telemedicine. So can students still go to the health center for non-COVID related things right now? And then what exactly does telemedicine appointments look like?
Sure. Yes, we are seeing everything that we always see students for. So we're doing a lot of COVID related stuff, but we also still our female health clinic is still in full operation. So we are doing female health visits via telemedicine. Just some off the top of my head, back pain, rash, other things that are not illness related. And so what happens with that is every student now this semester, the first step is calling the Student Health Center. When they call the Student Health Center, they talk to the front desk and they say, this is the reason that I need to have an appointment with the Student Health Center. The front desk will schedule them for a visit, but the very next thing that happens after they get off with the front desk scheduling is that a nurse is going to be calling them back before their actual telemedicine visit. And what the nurse is doing is what they would typically do if you came into the Student Health Center and the nurse comes in the room first and asks you some questions and checks your medicines and fills out all that information. The nurse is doing that by phone with the student. And then as soon as that is completed, the nurse actually sends simultaneously, it comes as an email and then also as a text message if the student has opted into our texting service, which is really important if they want to be able to do their telehealth visit over their phone, their mobile phone. The nurse sends out a message that gives them a link to basically the virtual waiting room of the provider that they're going to have a visit with. And then at the time of their appointment, they click on that link and it's just like we're doing now, Facebook Live, Instagram Live, Skype. They are going to get on screen. The provider that they're having their visit with is going to be on the other screen. And they're just going to talk and do an evaluation and assessment of what's going on. And then at that point, there are obviously reasons that we're going to have them here in person. If we're going to COVID test you, we need you here in person. It's kind of important. So the provider will then schedule a visit for that student to tell them what time to come in for their testing. But there's other reasons that we might bring them in. If it was a female health visit and they did need an evaluation, they would come in for that. We are still doing allergy injections through our nurse clinic, other type of injections. We're still running our lab, so we're doing blood draws. So we're still bringing students in as needed. The volume of that is much lower, and it will feel different to them. They're not going to see a lot of people in the waiting room or in the halls or even our staff. We are very structured on how we're moving throughout the clinic. And then the staff is going to have a lot of extra, masks and face shields and gloves just because that's a healthcare requirement right now with dealing with face-to-face visits with patients.
Gotcha. So kind of going more into like preventing for COVID and whatnot, can you talk about why the idea of social distancing is still really important, even though we're required to wear masks, why people also need to be social distancing?
Absolutely. And one of the things that I really want to stress is that contrary to what others are seeing out there or believing right now, the social distancing is actually more important than the masking. They're both extremely important and we require both and everybody needs to wear a mask. But there has been evidence, and the CDC has also stated this, if you look at any of their information, is that just having a mask does not protect you if you are getting closer than that 6 feet. So if you see, if you're within a group setting and you all are closer than 6 feet to each other and you're all wearing your masks, you are still at risk for spread if somebody in that group has COVID-like illness or symptoms. And so the importance of the social distancing is actually due to the virus is transmitted mostly through droplets that come out of our mouth, or it can, it's in our nose, and so it's aerosolized. So the social distancing is about trying to maintain enough distance that if any of those droplets did spread or were not completely contained, you're hopefully going to be far enough for that not to impact you. And so that is why even if you mask, even if everybody's masked, we want you to maintain that 6 feet. Now, and I also want to say that's not just like casual passing in the hallway. So we're gonna walk next to each other in the hallways and be closer than 6 feet, and we're all masked. This is for like sustained. I'm gonna sit down. I'm gonna be with somebody for 15 minutes or longer. Classroom settings, other settings, you want to have that social distance. And then when you're in an eating situation where obviously you have to take your mask off to eat, you actually want to try and increase that distance. And then we are also big promoters of outdoor activity. Dr. Williams, our medical director, who will be on tomorrow, he will tell you it is 19 times safer to be outdoors than indoors at this point, because all of our aerosolization and droplets are kind of spreading out versus being confined in a closed space.
Gotcha. So then who exactly is the mask protecting then? If it's not as effective as social distancing, what benefit does the mask provide people?
Yeah, absolutely. And that's another thing that there's some common misconceptions around. So the mask is not actually, if you and I, Shannon, are wearing masks, I'm not wearing my mask to protect myself from you. I'm wearing a mask because if I have COVID, I am containing that illness within my mask. So I'm actually protecting you, which I think is a very important thing. I've had this conversation with several people where they feel like if they're in a situation where they are wearing a mask, but others are not masked, that they are protected. And that is not the case. So you want to be really mindful of your own safety and others. And it is important for everybody to be wearing masks in both situations. And it is to essentially contain those aerosolizations. Another thing that's important about masks, there was a recent study, Dr. Williams may mention this tomorrow too, because we talk about all these things together, but Duke University did a recent study about the different types of masks. And so the gaiters, which is kind of the neck thing that you pull up, they were actually able to determine not only is that not helpful, it actually is more harmful than not wearing a mask at all. Because of the way the droplets go through that gaiter material, it actually causes them to spread out even more. And so we are not gaiter fans as far as I know. That's the mask is called that in general. So what we want to make sure that people are wearing is a mask that can fit secure around their nose and mouth. And the other thing that I've seen a lot that I wanted to comment on is I see a lot of people that have the mask on, but they pull it down so that their nose is out. I know why people are doing it. I feel the need to do it. Something like you just feel like you can't breathe and you're like, man, if I could just get a little bit of air through my nose, I would feel better. But remember, when we swab you for COVID, we go into your nose to get the virus sample. So it's in your nose. So we want people to cover nose and mouth with masks.
Gotcha. So masks are required on campus, inside and outside. So what should one of us do if we see someone not wearing a mask? Should we say something? Is there someone we should tell? What should we do?
Yeah, I think everybody's going to approach that differently with their own comfort level of social interaction and just, we're in kind of high stress and high tension times, and we know that different people have different beliefs about what we should and shouldn't be doing. So I don't want to say that everybody's going to feel comfortable going up to somebody and saying, why don't you have your mask on? I will tell you, if I see you on campus without your mask on, I'm going to come talk to you because that's my job as the director of student health on this campus. But so if you feel comfortable, and it doesn't have to be confrontational. Like, we really want it to be more of kind of like a community type thing. So, hey, we're trying to protect everybody. so that we can stay here. I think that's a really common thing across college campuses right now, that I don't want us to get hung up on, this age group and does it have a big impact or not, more so on this group versus older people versus other demographics of people. But what we're trying to do is stay here and have some level of social interaction and some level of college experience. And if we are not masking and protecting each other and our numbers start to rise and rise and rise, we've already seen it in other universities across, the nation, we're going to have to close down and go back home. And so I think using it as kind of a community approach, hey, we all want to stay here and do this together, so let's wear our masks, let's protect each other. If they don't feel comfortable with that and they feel like they really do need to reach out to somebody to help them, for students, that is the Dean of Students office. And so they can go to the Dean of Students office, express a concern. And I don't think it only has to be about somebody not having a mask on. If you see large groups of people gathering, we're saying don't do that. We're asking you to, keep your numbers low, keep your social distance. So anything that students have a concern about, the Dean of Students is their direct contact. And Dean Yearbeck is great. He's a lot of fun. He's really good with interacting with students. So students who don't know him, I want them to know that will be a comfortable conversation with him.
Great. So I think the last question I have is for students, if they do test positive, what happens?
Yeah. Well, there's a lot of answers to that. Yeah. What happens? So, and I will tell you what happens if you come through the Student Health Center. And that's another thing that I really want to encourage students to do, even if you haven't, if you've been here for several years and you've never used the Student Health Center, you don't really know what that's about. For this particular situation, we want you to use the Student Health Center because what that gives us is more direct contact information to help protect our campus. So if students are getting tested offsite or in their own community, we may not, the only way that we, meaning Sam Houston, gets that information directly back is when the student self-reports. So I will start with that because that's important regardless of where a student gets tested. If they have a positive result, our campus requirement, not just for students, faculty, or staff, have to report that through the COVID webpage. And there's a little link that says report my positive result. So they are reporting to the university that they have tested positive for COVID. And to dispel any myths around that, like where does that information go, how many people are getting it, it actually comes to me. And so it's coming directly to me. And then I'm responsible for reaching out and contacting the right people to do what we need to do. There will be a follow-up phone call from either myself or Steve Jeter, who's our emergency response person, just to ask the student a few more questions. We need to know, when did you start having symptoms? Have you been to class? What other places have you been? So again, we can make sure that we're communicating out to anybody that might need to know that they might have been exposed. But once you get that positive result, as we talked about in an earlier question, you're going to go into isolation. And so what isolation means is that you have at least 10 days where you are isolated. So you're going to be back at your home, your off-campus home, or your permanent residence if we can get you home. Or if you're on campus, you are going to be isolated in a specific dorm that is for isolation, that has individual rooms, specific residence hall. I've learned that we don't use the word dorm. It's a residence hall. That just popped in my mind. That came up about a week ago. So specific residence hall, private room, private bathroom, meals are going to be delivered to you. The health center is going to call and check on you daily, just to make sure that you're not getting sicker, that we don't need to do additional things. And then you're going to stay in that isolation status for at least 10 days. And then at that 10-day mark, we have to make sure you haven't had any symptoms for the last 24 hours. And then if that is the case, we, the Student Health Center, will release you from isolation to go back to either your residence hall that you moved into at the beginning, to go back to classes, to move around campus, things like that.
Awesome. So we have one more question pop up. You were talking about the self-report form. Can people also self-report by just calling the health center?
I'm going to say no, just because the self-report is specifically designed to get, it answers very specific or asks very specific questions that I need to know to move into the next steps of what we need to do as far as a campus response. So now I want to also say, fill out the report. But then if you have additional questions, let's say you haven't had your test with us, you've had it somewhere else, but you have unanswered questions, call us and we want to talk to you and answer those questions and guide you. But actually going to the official reporting site and filling that out makes our process so much smoother and easier, and really accomplishes that campus protection goal that we're broadly trying to really reinforce and make sure that we're doing.
So if someone called to report, you probably would direct them to the website.
Yes. And I will say that I get phone calls and emails and other things like that. And I welcome that. I answer the phone as many times as I can if I'm not on the phone with somebody else, and I get back to emails as quickly as I can. So if they feel like they need additional information, we want to provide that to them. But the first step for us that really kicks off that process and helps us support them better is to actually go fill out that form, which is on I call it the COVID site on the university. So if you go to the main page at the top red bar, you can click on COVID and you'll see all the information. You'll actually see our cases reported there. So that's a quick look if you want to see how many cases have been reported. We added a new feature just today that shows the 2-week total of cases to kind of watch what trends are happening as well.
So as we wrap up, is there anything else COVID related that you want to make sure that students know?
I think just the main thing is for them to know that we are really, and we being the Student Health Center, we are really encouraging an environment across the campus, and on the academic side with faculty and professors. I have a lot of conversations with a lot of faculty every day, and we are really encouraging them and students as well. If you are feeling sick at all, please don't go to class. Communicate with your professors, communicate with us. We really want to, we know that COVID is here, right? It's nationally, it's a pandemic. So we can't say that we're trying to keep COVID from happening ever on campus, because we are going to have COVID cases. We can look at the website and see that.
Right.
What we are trying to do is control that as much as possible. And so the more we have a supportive environment, we feel comfortable self-reporting, we feel comfortable saying to our professors, I don't feel good today. And it goes back to literally, I woke up with a headache and a stuffy nose, and I'm not sure what it is, but it might be COVID. So I'm not coming to class, and I'm going to reach out to the Student Health Center and see what I need to do next.
So just better safe than sorry. Being
Absolutely. Absolutely. And I think that we would want others to do that for us.
Right.
And so we want to just have the same respect for each other to say, if we're not feeling good, we're just going to sit that day out, and we're going to call and see if we need to get medical evaluation, or what we need to do at that point.
Great. Well, thank you so much for joining me, Erica, and answering all these questions.
Absolutely. It was fun.
I'll talk to you later.
Bye. Take care.
All right. Well, thank you to everyone who joined us. And as we mentioned at the beginning, be sure to join us again tomorrow at noon, and we'll be talking to Dr. Robert Williams, who is the medical director of the Student Health Center, to answer any more COVID-related questions that you guys might have. So see you tomorrow.